Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and today we're going to be looking at a hairy cell leukemia.
Bad hair day, huh?
Mm.
I don't have any.
It's kind of like me when I don't straighten my hair.
Stop.
I'm all fuzzy. So,
This is a mature lymphoid
yes,
neoplasm, if I remember correctly.
it is.
Cool.
It's a mature B cell.
And yeah, they're kind of messed up. So like a lot of times we'll talk about like chromatin pattern and a lot of these malignancies and stuff. In this case, it's usually pretty useless, right? It's a
Yeah,
mature pattern.
mature cells. So now we're literally looking for hairy-like projections.
Yeah. So, and I just thought to myself, we don't really look at cytoplasm for identification very much, right? In practice, we usually use the nucleus and chromatin patterns a lot, but we'll be focusing exclusively on the cytoplasm.
Yep. Yeah.
Cool.
So we purposely stopped on this field. The reason being is generally it'll vary by patient, but a lot of hairy cell patients have a low percentage in the peripheral blood. So once we look at this one, we might scroll around and never see another hairy cell.
Yeah, it's totally possible.
So that's why I wanted to stop on it and just kind of point it out. And the problem, the big problem that we have with hairy cell is that you're going to have such variability in calling because this is a hairy cell and these are your hairy like projections.
Hmm. Hmm.
This whole thing right there, that is the hairiness, that's it.
Hmm. Yep.
So that's the challenge, is identifying a hairy cell from a regular lymph, because the like Dave was just saying, the chromatin patterns, they look similar, they're both mature chromatin. It's really the cytoplasm.
There's a couple other things too that are kind of working against the morphologist that might look at the slide too, I think, is it's like a gift when you have a severely anemic patient, thrombocytopenic, and then there's weird cell morphologies, right? So with the myelocytic anemia, right? The you kind of have a signal outside of the actual cell morphology. But here, those platelet numbers look pretty normal to me. Heck, it might even be a little bit increased. And maybe a little anemia, but nothing that's super alarming for like an acute. I see a schistocyte hanging out at the top of the field there, but I mean, yeah. So um, this would be somewhat easy to miss, I would say, for someone practicing this on the bench. But
Well, especially new techs or students, excuse me, new laboratorians or students,
Mhm.
because you're not looking for this. You're so focused on, oh, it looks normal. Okay, there's no blast, there's no anything really exciting. So you can be like, it's just a lymph. And on the flip side, sometimes lymphocytes could have a little projection, normal lymphocytes. And so you don't really want to start looking at just every lymph and thinking it's a projection. You have to take it in the context of the slide. Are you seeing a couple of lymphs that look like this? Or, 5, 10%, whatever it is,
Mhm.
not just one random one.
Right. Yep. Yeah, it's totally plausible that I look at a cell like this, and it's maybe the first cell I do, and I kind of like make note, and then my diff continues.
Absolutely.
Cool.
Well, let's diff continue then. Move around and see what else we can find.
Hmm. Mm. Yeah, so again, like I would never in my wildest dreams be like, oh, definitely a hairy cell, bet everything on that. But we know what the slide label is, we know what the patient's diagnosis is, and that previous cell, right? That previous cell is a really strong signal for me to be careful and attentive to this. But this looks like it might be a hairy cell. What do you think, Melissa?
Yeah, it could be. I think newer laboratorians and students might look at it and think, well, it just looks more smudgy. But
Mhm.
sometimes hairy cells look smudgy.
Yeah, yeah.
It'll vary by patient. So I think too, again, another one where you kind of take note of it and then keep
Mhm.
chugging along and see what else you find.
Yep. Keep gathering evidence. Yeah. Yeah, and I would not be able to make a definitive call here. I probably would just go lymph EO. All right, two
So
lymph.
I'm stopping because of the blebs.
Yeah, the blebs. So my face crunched up a little bit, right? So, um, so like hairy cells are supposed to do projections, right? But inherently, there's just some kind of issue that causes the cytoplasm to look weird. So now these blebs are kind of like weird. But you can have a totally normal patient with lymphs that have little kind of blebby things. So just being careful.
So I
I
think the blebs I would just call a lymph.
Yeah, just
I would,
lymphs,
I would look for
100%.
the hairy like. I wonder if this is one of those hairy like projections over here.
So on top of that one, yeah, that looks suspicious. But the other cell on the bottom right, I'd probably just say lymph. Yeah.
Yeah, agreed.
Um, mhm. Yeah, lymph, EO, lymph. Oh, well, so there's some projections coming out of that lymph now, right? So I think at this point, the I would have a strong. I'd be very compelled to give this to pathologists, and maybe before I'm even done with the diff, I note this in my mind. This is now looking weird. So
Yeah, absolutely. And in that clinical setting where you can say to the pathologist, "Here you go," kind of like your job figured this out, whether these hairy cells or not, kind of thing. Go to flow. For students, usually the slide is labeled hairy cell, and you're gonna get a decent hairy cell. And if it were I would assume if it were a practical slide, if you got a hairy cell, it would be like a
yeah,
beautiful looking, textbook sort of hairy cell and not something like this guy here.
I kind of love it because we're peeling back the curtain a little bit, right? But um, us as instructors, I would never, ever, ever want to make a student make a call off of that one particular cell. That's really cruel.
No, you want to give a beautiful, obviously, I'm looking for you to call it a hairy cell.
Yeah. Mhm.
It's more of like once you're practicing and you run into these and you're like, oh.
Yep. Yep. Yeah, so there are two different worlds. So your education environment is going to be a little bit different inherently than the actual practical in the lab doing the work. But generally, if you err on the side of being more conservative, one of the things I like to do too, you have your diff counter and you have lots of different spots for your cells. Maybe it's nice to have an other category, and you can put these in the other category and note to yourself that they're lymphocytes. And if you get to the end of your diff and you only have two other, just throw them in the lymph category. It's probably a safe bet.
Yeah, the other thing that's, I think, that the same population, newer laboratorians and students, they don't think they should have to, but the number of times that I start a diff and then restart it and then restart it is very high because I'm counting a diff and I think I count it one way, but I find out, oh no, I really want to call these hairy cells, or no, I really don't want to call them, and there's a significant population or something similar to that. That's when I would restart my diff. So restarting a diff does not mean that you're bad at diffs. It means that you're doing your job and you're trying to, really identify the cells correctly.
Yeah, I agree with you 100%. If we're doing like normals and we're speedy and we're efficient, but man, when it gets to tricky stuff, we're always ready to start over. I will get to cell 99, see something, and it won't matter. I want to do that diff again with that greater insight. And I know for our student, training techs, and to lose that time doing your diff is incredibly painful because it takes you a while, but it's the right thing to do, and it's a great habit to get into now. Thank you, Melissa, for bringing that up. It's important.
All right, let's move once more, and if we find another hairy cell.
Sure. Yeah. Let's see what we got. What are the diff gods going to give us? So you got little bumpies. Does that look like? Yeah, it's like an isolated area of
Yeah,
projection.
that could be like one little hair.
Yeah, yeah, yeah.
But nothing too exciting. Oh, this is fun.
Yeah. So what's key here? So these two cells being in close contact like that with one another, generally, is it possible on a normal smear? Yeah, it's possible, but statistically unlikely. But the fact that they're both fuzzy and they're both stuck together, this would seal the deal for me personally. Yeah.
Yeah, I agree. I saw these little projections and I was like, ooh. So that's why, yeah, definitely.
Yeah. Cool.
Well, I think that's everything we wanted to cover for hair cells. So thanks for watching.
Yeah. Thank you for your time.
Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video, and feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.